1993, I submitted it to the Journal of Manual and Manipulative Therapy, and it was published as the biomechanical model of the thorax, and it's a description of the osteo and arthrokinematics of the thorax during flexion, extension, side bending, and rotation. And that model has been incorporated into multiple physio schools. It was then further published in Ruth Grant's book on the thoracic spine. You'll see citations that refer to, this biomechanical approach, which is totally derived from the clinical application of looking at Punjabi's research and then taking it into the clinic and seeing what of that works when the ring is intact, what of it doesn't. So the word thoracic ring was coined in 1994. We used it earlier than that. And it was a patient.
As early as that?
Yeah. Okay. Oh, yeah. A patient who could not produce ipsilateral side flexion and rotation in his mid-thoracic spine because his fifth costocartilage had been surgically removed. So there's a lot of congenital anomalies around the costocartilages in the thorax, and he had this eversion that he didn't like, his parents didn't like, and they managed to talk a surgeon into taking it out.
So is that what made you come up with the terminology, thoracic ring, the fact that this guy did not have a complete ring, and you realised
Yes.
at that time that, if that ring is not complete, is that...
You will not have optimal
Okay.
biomechanics, yes.
Okay.
So we talked about thoracic ring biomechanics as opposed to rib biomechanics and spinal biomechanics, recognizing that there is a dance or a collective motion that happens in the entire ring, and it can be driven from the spine, movement of the thoracic vertebra. It can be driven from one rib. So you get this resultant physiological combination of movements that happen. But the ipsilateral coupling of side bending and rotation can only occur if the ring's intact.
Right.
Punjabi found in 76 that rotation couples with contralateral rotation. This ring, in this 17-year-old boy, hockey player, he could only produce contralateral coupling of the ring, side bending and rotation.
So there it was.
So there was. He had his rib was detached from the front. So it started a long time ago, and we were looking still in those days, in the 80s and 90s, very biomechanical, right? Very much about the joint, what the ligaments do, how do we stress test these things.